Dr. Chin worked in the obstetrics and gynecology department of a large hospital. One day, just before getting off work, a patient came in. He hurriedly examined her and said, "There might be something growing in your uterus. It's best to have surgery as soon as possible." The patient's face turned pale instantly. No wonder she had been feeling weak and anxious lately. Fortunately, it was discovered early, so it shouldn't have spread. The surgery was quickly arranged. For Dr. Chin, who had performed thousands of surgeries, this tumor seemed small and would only require a small incision. However, when he opened the patient's abdomen and observed deep inside the uterus, he was stunned, sweat beading on his forehead. This was an unprecedented mistake in his decades of practice. The uterus didn't contain a tumor, it was a fetus. He found himself in a dilemma. If he removed the fetus and told the patient it was a tumor, she would be immensely grateful and assured that the so-called tumor would never recur. On the other hand, he could quickly suture the incision and admit his mistake. After a few seconds of internal struggle, he chose the latter. Returning to his office, he waited for the patient to wake up, then approached her bedside. His serious expression made the patient and her family members tremble, bracing for a terminal cancer diagnosis. "I'm sorry, I made a mistake. You're just pregnant, there's no tumor." He apologized deeply. "The baby is fine, and you will surely have a lovely child." The patient and her family were stunned. After a few seconds, the patient's husband suddenly rushed forward, grabbed Dr. Chin by the collar, and shouted, "You incompetent doctor, I'm going to sue you." Later, the child was safely born and developed normally. However, the family was relentless, and Dr. Chin was dismissed from his position and had to work at a private hospital. His old friends sympathized with him and asked why he didn't just cover up the mistake by saying it was a deformed stillborn. Who would know? Dr. Chin smiled faintly. "God knows.